Look into the ceramic application, right? The bone and the dental regeneration, it plays a major role. And metal-based nanocomposites like the silver or gold nano or particle exhibit the antimicrobial properties for wound healing as well as the implantation. For example, the silver and gold I can say the first form, right? So that will be that will be acted as a metal-based nanocomposites. And the hybrid nanocomposite combines the matrix and nanoparticles to achieve the multifunctional properties and improve the biomedical performance. So moving to the processing techniques, like into the what are the techniques are used for processing the biomaterials. So the first method is the salt gel processing. It is a chemical method forming the nanocomposite at low temperature and is ideal for bioactive component separation. And moving to the second method, electrospinning techniques to create a nanofiber structures with the high surface area, perfect for the tissue engineering applications. So moving to the next method is the melt blending technique. It mixes the nanoparticles, polymers at high temperature. It is widely used in the industrial nanocomposite productions. And the texture is a layer by layer assembly, like building the nanocomposite through sequential deposition, allowing precise control over structure and composition. It's like kind of the additive manufacturing day. So as I discussed a while ago, the major applications into the biomedical for the nanocomposite, the targeted drug delivery, right, will be helpful to deliver a drug in a controlled release of drugs, enhancing therapeutic efficiency and minimum side effects is possible by delivering a target delivery of the drug to the human body. The tissue engineering, the nanocomposite mimic extracellular matrix, support cell growth and tissue re-engineering, and orthopedic implement as the ceramic based, like the nanocomposite improve the implant strength, bioactivity, promoting the bone integration and reducing the failure. Because once it is implemented, some kind of part inside your bone, it's supposed to be stay for a long time with you, right? And it's supposed not to be broken at any point of time. In order to improve this property, the nanocomposites are added, right? It will helpful for improve the strength of the bone and antimicrobial wound healing nanoparticles in wound materials infection and accelerate the tissue healing process. So here just look into the some of the case studies on the polymer nanocomposite FDM process, right? So the polymer matrix has a 5% of nanoparticles, only a 5% of nanocomposite, right? It has improved the performance, right? Precisely blending with the help of the twin screw extrusion technology. People working as a composite, you know about this. And look into the clinical application, it enables the fabrication of porous, lightweight, and biomedical implants that includes the customized need, substitute fashion-specific geometries. As I said previously, right? So now the treatment of fashion made the customized, tailor-made component. Today the technology has been proved like anything, like not like in the olden days, because of all the advanced technology. It makes the fashion more care and what is good for them and what is not good for them, and what is the design is prepared according to the fashion needs. It's possible to design and develop nowadays. So the quality has shown. So how the quality should be ensured? As I said, the various characteristics of the technology, which using the XPS, XRD, and DSC, all those things will helpful to ensure that how the nanocomposites added mixed with the matrix material, how the behavior is happening. All those things should be studied for characterization. Any of those things are added in the later slide to the elaborated way. So ceramic based nanocomposites in orthopedics. While ago I discussed with you like the biomimetic design, right? So the hydroxyapatite HA nanocomposite mimics the natural bone. It look like a natural bone of mineral structure and promoting seamless integrating existing bone tissue. So this HA will be mimic like a our human bone, right? So this will be implanted into the human body, and it has the exceptional wear resistance, biocompatibility, and it has a very good property, and it has a very good load bearing implantation, productive coating, and still the life of the component. So today people are working on advanced coating, significantly improve the implant longevity while dramatically reducing the risk of biological rejection. For example, if you look into the my area of metallic things, we used to go for the coating. The coating helps to extend the life of the material. For example, a power plant, right? So if you start running the material, it will be started corroding in a year or two or year three, right? So we need to run a plant for more than 30 years, right? For corrosion issue, if you shut down the material, to restart the power plant, it takes very money, and the time waste. Production will be get off stopped. In order to address these issues, in order to improve the material performance, we generally go for the coating process. So similarly here also we have to go for the process improve the property and life of the materials. Yeah. As just a while ago, the carbon-based nanocomposites, the biosensors as well as the drug delivery applications, right? So the carbon nanotubes provides enhanced electrical conductivity and increased the surface area for superior sensing capability and ultra sensing detection. The biosensors are capable of detecting the disease, marked at previously unattainable level for early diagnosis is possible. And targeted therapy. So the controlled drug release platform provides the precise targeting and significantly reduce the side effects of cancer treatment. So we can directly deliver a drug in a particular place where we can avoid unnecessarily effect onto the side effects for particular the cancer treatment. So this plays a major role actually the carbon the nano composites. So again, looking to the advantage, if you look at it, it has enhanced mechanical strength, bio compatibility, the controlled drug release, and antimicrobial protection, as just been discussed in the previous slide. Here also. Yeah. So what are the challenges behind it, right? So because each and every technology having been into the development stage, the researcher used to face a lot of challenges actually. So what are the major challenges for the processing of nanocomposites, the biomaterials? For example, the first one is the fabrication process. We have discussed the different fabrication while ago. And what is the nanocomposite fabricate required the precise control to achieve uniform because they are added a very tiny particle into a very big matrix. So we have to control and achieve the uniform, the mixing and different functionality of the bio and the biological application is one of the most important things. And toxicity and safety concern. Again, it is one of the most important concerns. Can you look into that? Like the potential toxicity of nanoparticles demand biocompatibility testing to ensure safety and minimize long-term risk. As I said, because we are going to play with the human life, so it should be ensured and tested in a proper way before applied into the human body. And the regulatory and clinical hurdles. So because the clinical hurdles, looking to the bio, they know very well. And getting the approval, the regulatory authorities much easier as compared to any other technique. Wherever they are playing with the human being, so the technology is going to plant the human being, right? Tested with the it is one of the most important, and it is not easily to get into regulatory and put into the real time application. And the last most important thing is the cost and scalability issue. So usually it will have the high production cost and the scalability challenges, limits and widespread option of nanocomposite material in the healthcare. So again, the research and development, the cost plays a major role. We need funding to do developing a nanocomposite for a particular application, because it involves more funding. Starts from the characteristics of material to implement into the real time applications. So in India, I hope the ICMR is doing a very good funding for this kind of research activity. Yeah. And the challenges and future directions. Related to that, managing the nanocomposite distribution to prevent agglomeration while minimize potential toxicity concerning biological environment. And the next one is the material balance, optimizing the delicate balance between the biodegradability, mechanical strength, and cost effectiveness for the clinical viability. Again, the challenges, the regulatory policy discussed, the safety evaluation and regulatory approval process is essential for successful clinical translation. Innovative trending. The people nowadays, everything is related to that. It is bio and it's design. So it is one of the emerging area working on it. The emerging focus on bio-inspired hierarchical, structural, and multiple nano composite with adaptive properties. Yeah. So what is the further innovation? Right? The smart nanocomposite is one of the futuristic thing and people are working. I hope the smart nanocomposite response to environmental enabling targeted therapy and advanced diagnostics and personalized medicine. Nanocomposite tailored individual patient needs, treatment efficacy and healthcare outcome, as I said just a while ago. So depending upon the passion, the situation, right now today started developing a medicine and A and ML integration. One of the most important things in every application. The biomedical. Yesterday I visited one of the leading industry in the country. So they are every day they are processing 30 lakh data to their plant efficiency, right? So similarly, here AI and ML learning integration is one of the most important, because when we have this data, more number of data, right? When we have the more number of data, when we keep tracking the data, and we can identify. So this composition is for these people who have this kind of vital. So it is one of the most important things. Now every people are started adopting the A and ML, and particularly recent days medical field is emerging like anything by implementing the A and ML integrations. Recently I was attended a workshop with the CMC doctors at Vello. They delivered a talk at Creative Vello. So this one of the trending area, the integration of A and ML in the medical field is highly wanted now. And the sustainable nanocomposite development of eco-friendly nanocomposite uses biodegradable materials and green methods. Yeah. So this is the last slide on the technical part actually. The future is the nanoscale, right? So we have the diagnostic and the therapeutic implants and innovation. So the nanocomposites are transforming the healthcare advanced processing techniques and enabling tailored high performance material, the strongest revolutionized diagnostic therapeutic and implant device for the healthy life. So the first part of my presentation is ended here, and the second part part of my presentation talks about the Indian research and strategy on nanocomposites for biomedical applications. So as I said, this presentation is for three different types of verticals. One I talked about the complete of the nanocomposites, and second one, what is our strategy, where we are, and what we have to develop further, right? So those things are here. The revolution is in healthcare through the convergence of ancient wisdom and cutting-edge nanoscience innovations. So if you look into the ancient root of nanotechnology of India, right? So previously we used this thing, and Ayurvedic medicine is the first nanocomposite particle, right? For example, the Indian legendary Damascus steel is demonstrated as a nanocomposite before the modern nanotechnology, like the nano tubes are coming to the picture. And if you look into the ancient physicists uses the gold as well as the silver as a nanoparticle, like the busbum, as I told you previously, for a therapeutic application, showcasing the nanomedicine understanding. So this foundation of centuries, the world nanoscale knowledge provides India with unique philosophical and practical approach to the modern nano medicine development, bridging the traditional healing wisdom with the contemporary biomedical innovations. So nano mission strategy, India, like thousand crores investment has been done in the year launched in the year 777. So but the nanoscience and technology mission, and India has positioned top five in the global, China, US, Korea, right? That India is also one of the top five countries as per the publication related to the nanoscience publications. So worldwide the research development, world-class research university and promoting collaboration across the institution is required to strengthen and improve our R&D in this area. So infrastructure building, creation of the state-of-art of laboratories and characterization for the nano development required. And again, the human capital is one of the most important things. Here, the training of the scientists and fostering the next generation research in the nanotechnology application is important because we have to transfer our knowledge to the students to the next level, so that our research will be to improve, and this will be directly impacting to the healthcare, and the healthcare will be improved day by day because our country population is very huge. And global partnership, establishing international collaboration, accelerate knowledge and innovation. Yeah. And it is another one way where we can able to increase our strength on this particular area. Right? People are traveling abroad and they study there, and we are inviting the people from abroad to here, the best doctors in the world, best researchers in the country, different countries. We can invite them here, and we can have a different types of workshops or conference, or the collaborative research work will help to improve the research in this domain. Yeah. So if you look into the country, who plays a major role to this particular technology? For example, the IISc is pioneering the nanomedical synthesis and biomedical applications with cutting-edge research and nanocomposite development as well as characterization. In India, we have a very good facilities at IISc Bangalore for this particular research, and NITR Mohali, the leading delivered innovation advanced nanocareer system and targeted therapy applications. And JNC is Bangalore conducting research on the nanomedicine research, integrating biology as well as the material science. And various IITs are completely working on the nanocomposite biomedical devices and implantation medical technologies. So the cutting edge research application in biomedical sector, as I said previously, also the past also I was one is the targeted delivery, right? To revolutionary system, side effect and improving the efficacy in the cancer treatment and the chronic disease management through cellular targeting mechanisms. And nano-enabled biosensor like diagnostic enable early disease detection is most important. If you have identified the disease in the earlier stage, right, it will be able to save the life and So the nano-enabled biosensors plays a major role on this. And the next to the last one is one of the most important things. Every people has this technology. Like during the COVID-19 pandemic, the nano PPE and medical mask provides the enhanced protection and antimicrobial properties for healthcare workers. Even not only for the healthcare workers, even we use the mask price is 2 rupees or 3 rupees, but it protect our healthy environment during the COVID-19 pandemic. We used to say just buy a the mask medical mask, right. So come to the cost is very cheap, but it plays a major role during the COVID-19 period. So from the lab laboratory to market innovation, right, the different stages like industry focusing shifting biopharmaceutical companies are increasingly investing in the nanomedicine for diabetic, cardiovascular disease and other chronic disease. So in India the population is very huge. Also similarly we have people are affected with the different diseases, right. So the startup ecosystem, emerging startup and academia industry collaboration improve and accelerating the development of a nano-based drug delivery system and diagnostic platform and clinical translations like multiple nano-based drug delivery progressing clinical trials, several approaching market introduction and commercial deployment. So as I discussed with you again, I don't want to continue the same slide again and again. The regulatory framework challenges from the paper to the real-time application is challenging. So the vision 2030, the future of nano-composite innovation, the AI nano integration, as I said just again, right. So the AI and the ML plays a major role. It is not only into the discipline of nano, and it is for all the application engineering. The people are working. Data analytics, data collections, implementation of AI to the data, right? So integrating, right? It is going to become a very big job opportunity in different engineering fields. So the green systems like scalable, sustainable, and biodegradable composites for producing using environmental friendly approach and renewable materials and collaborative ecosystems, strengthening academia, industry, and government partnership to accelerating the commercialization and establish global leadership in nanomedicines. Yeah. So Indian nano composite revolution in the healthcare, so heritage and innovation, strategic investment, all to the action. From the ancient wisdom to modern innovation, India is uniquely to shape the future of biomedical composite strategic and collaboration is going on. And I request the people who is interested on the biomaterials and contribute to the national growth and bridging the centuries of traditional knowledge with the cutting-edge research on nanoscience and sustained funding and policy supporting breakthrough discoveries with real-world impact and call for the action and support continuous research, innovation, and the regulation for safer, smart nanomedicine solutions. Yeah. So I move to the last part of my presentation. As I said, the three different types. It was designed with three different verticals about the basics of the nano processing and application. Second one is the strategy of India. And the last topic of today's presentation, maybe another 10 to 15 minutes, the characterization technique of nano for biomedical application. As I said, when we are started doing the research and development at the laboratory scale, so this plays a major role. This topic of content what I am delivering now playing a major role. So understanding the intricate properties of nanomaterials for revolutionary medical application, we need to go for very studies, characterization to evaluate the right? The FTSM analysis, the TEM analyzing, and the SPM and the NSOM play a major role. For example, since I'm a material man, right? So we use the most important tool for us is the SPM as well as the TEM analysis. Even it has any applications. For example, I'm particularly working on the corrosion, welding, additive manufacturing of different engineering applications, right? The foremost important study is the SCM as well as EDS as well as the TEM analysis of imaging, right? So what we are able to see at this particular research. So here we could able to study about the surface morphology at the nanoscale resolution from the most important insect to the architecture, where we could understand how the structures look like, how the nanocomposite the matrix, what it plays a role, and move to the transmission electron microscopy, right? And people working on the metallic material, as well as the TEM, right? Study about the internal structures, mapping particle able to study by the TEM image, and move to the scanning probe and the near field optical microscope capture the surface topology and nanoscale optical properties with the unprecedented details to be able to analysis. The small case study has been added here in a tool like the TEM analysis revealed the uniform carbon nanotubes with the polymer matrix and directly correlating the enhanced mechanical properties with the biomedical instrumentation. I hope many people have done this kind of study, and not even at nanotube in a discussion. Even I understand from the Mayapur region, many people are working on to the composite material, right? Added with a small quantity of, particularly to the aluminum metal composite, added with the different types of the residues like the titanium, zirconium, whatever XYZ, different types of alloying elements are added, and how this are dispersed into the material, and the study has been evaluated with the different characterization like a CEM, PE, all those things. And it is not new for the people. And structural analysis by using the XRD analysis, right? So one of the most important thing is the XRD analysis. To be able to trace the faces as well as the structure, right? How it will be like. Those things can be evaluated by using the XRD analysis. So XRD confirms the successful incorporation of bioactive glass nanofiber polymer scaffolds, optimizing the bone regenerative properties. So one of the case study. So moving to the another different types of characteristics like the XPS, EDS mapping, and the analysis. For example, the XPS photo electron spectroscopy determines the elemental composition and chemical bonding states on the nanocomposite surface, crucial for the biomedical application assessment. And moving to the EDS mapping, right? So the EDS is not a equipment. I hope many people are working on this material because EDS as well as the EDS always attached to the SCM machine actually. Right, the EDS energy dispersion spectroscopy provides the spatial elemental distribution map and revealing the pillars throughout the composite matrix. So for example, when we do the studies on the metallic material, we used to see how the composition of layer, for example, the corrosion study, how each layer the oxides are formed and what are the elements are absorbed at layers level percentage able to calculate by using the mapping analysis. And moving to the sense analysis, secondary ion loss spectrometry identifies surface molecular fragments, enables detailed understanding of interfacial chemistry and cell interaction mechanisms should be evaluated. And the last finally the key insight from this, the surface chemistry covers biocompatibility and cellular interaction, making this technique indisciplinable for the biomedical applications. Yeah, and it is not only to the the optical property evaluation, again thermal and mechanical characteristics. The various figures can be done for example the DSC analysis, the TG analysis, and DMPA evaluation. For example, using the DSC analysis to be evaluate the thermal transition, including the glass transition and melting temperature to be able to find out. And TGA again thermal degradation of the polymers or composite, whatever you able to study under the sterilization and psychological conditions. And DMPA dynamic mechanical and thermal analysis measures the viscosity problem under simulated psychological conditions and mechanical stresses. The critical impact of this ensures the nanocomposite body temperature fluctuation mechanical stress encountered in the biomedical application. The most important thing. So next one is the particle size and dispersion in solution. As I said, right? So this nanocomposite is a very tiny part here, but we are mixing within a very huge matrix element, right? So the particle sizes and the solution should be evaluated called the dynamic scattering. Determine the nanoparticle size which using the biological suspension provide data for predicting cellular uptake efficiency. Application like the graphene oxide polymer nanocomposite enables the precise control of particle size for targeted cancer therapy delivery system. This is one of the most important things. This technique will help to bridge this gap between the synthesis and the biological performance and ensuring the therapy efficiency. So I'm about close to the end of my presentation. As I said, like 15 minutes. The current limitation and challenges the future in this session. The sample preparation, affect the result. They should be very careful in preparing the sample because not only for this particular biomedical application, for any application. Right, for example, if you are going for analysis, if your surface is not good, it has the ups and downs. Even optical microscopy, you are not able to see the picture what is on your interest. It will be blurred image, right? So always for any study, the preparation of sample is one of the most important things. The resolution in the nanocell analysis standardization across the techniques. Because the equipment not be here to analysis the results should be very perfect. So that's why always any biomedical, right? It will be accredited for the NABL. Some of the accreditations of the NABL. For NABL for the hospital equipment is there to recollect the name exactly. Even at DIT now we are going for the NABL accreditation because when we are going to test the samples, not only for the biomedical, for any materials, right? Particularly working for the industry consultancy. So it is the way we have to ensure our equipments are high standard and more precious. And we are keep maintaining because when we are going for those kind of certification, right? So people believe that you are maintaining the proper industry standard. So the result what you are getting is 100% accuracy without any error. Because getting a certification is not even for the equipment. So that's what every hospital they recognize NABL certified laboratories, right? And it is very important for the medical research. Next one is the multimodal approach. So integration of microscopy, spectroscopy, and mechanical spectroscopy provides comprehensive material understanding for the biomedical application. Yes, it is absolutely true. And move to the emerging technology like MRF, magnetic resonance microscopy, and advanced techniques promising under unprecedented characterization capabilities. Yeah. So move to the conclusion of unlocking the nanocomposite potentials. So there's the essential foundation, advanced characterization for the cornerstone for understanding and optimizing the nanocomposite biomedical application. The comprehensive analysis is critical morphological structure, chemistry, performance parameters essential for safety and therapeutic efficiency and healthcare transformations like continued innovation in characterization methodology drive the next generation biomedical nanomaterials revolutionized healthcare delivery and patients outcome. The future of medicine is nanoscale. So we will line I conclude these presentations. Thank you all. Thank you all.
So, participants, any doubt? No? If you have any queries, please raise now. Or otherwise, you can use the chat box also. Please.
So, able to see a good number of participants.
Yes, sir. So, just now ask few questions. No, that about your doubts.
Thank you, Mr. Muthu Pandian, for your accomplishment. Thank you, Prem Kumar. Thank you, Satish. Dawal,
Yes,
sir.
sir.
Sir, if no more questions, then shall I wind up the presentation?
Okay, sir. Okay, sir. I think there is no questions. No, we can wind up, sir, please.
So thank you for the opportunity once again, sir. Thank you very much. Looking forward to some other occasions. Thank you.
Please, sir, just a minute. No. So now that first session has concluded by Dr. Manikandan. So I like to express my sincere thanks to Dr. Manikandan for spending his valuable time and given a lot of ideas and materials, nano materials related to biomedical applications. On behalf of the participants, I express a sincere thanks. And you know, if you have any queries in future days related to nano materials, even the other thing is, sir is very well in the welding of dissimilar metals and other things. No, particularly he is related the joining of metals. It may be that new process they are using, and he is also working in the welding of thermal storage equipments. So thereby, if you have any queries in future days, you can contact me, or otherwise directly contact Dr. He is Dr. M. Manikandan. So I introduced Professor and Head, Vellore Institute of Technology in the Department of Design and Automation. It will be helpful for your research, particularly related to the welding area. So with these few words, thank you, sir. Thank you.
Sir, thank you very much, sir. Thank you for the opportunity once again.
Thank you. Okay, participants, that next session will start by 3:30 only. You please take a free up to that. You join at 3:30. So before that, you will get the feedback link. You fill it up, please. Just wait for a few more minutes. So normally I will post it 10 minutes before. Likewise, I will post it at 3:20. You fill it, then freshly come at 3:30 for the next session. you.